One of the most confusing things about pain is that it doesn't always stay in one place. Sometimes your lower back hurts and then it shifts into the hips. Sometimes neck tension turns into headaches or knee pain improves, but now something else starts bothering you. A lot of people assume this means something is seriously wrong or that their body is falling apart. But in many cases, pain moving around the body actually reflects how the nervous system and movement system are interacting together. I'm Dr. Lance Baumgard with Mobility Co Wellness. I provide mobile in-home chiropractic care and dry needling throughout Highlands Ranch, Sterling Ranch, Littleton, and the surrounding South Denver communities. A major part of what I do is helping people understand not just where pain exists, but why the body starts adapting and compensating in the first place. One important thing to understand is that pain is an output from the nervous system. Pain is influenced by tissue stress and irritation, but it's also influenced by how the brain and nervous system interpret what's happening in the body. Modern pain science shows us that pain is not always a perfect indicator of damage. Instead, pain is often the body's way of telling you that something isn't being handled or tolerated as well as it should be. This becomes especially important when movement patterns, posture, sleep, and repetitive loading start interacting over time. The body is incredibly good at adapting, and if one area isn't moving efficiently or handling load well, another area often compensates to keep you functioning. Now, that compensation can work temporarily, but over time, the extra stress placed on other tissues may begin creating symptoms somewhere else. So the pain may appear to move even though the underlying movement strategy hasn't really changed. A common example is low back pain shifting into the hip or glute. Sometimes the back becomes less symptomatic because the body changes how it distributes load. But if the hip or surrounding muscles start taking on more stress than they can tolerate, symptoms may develop there instead. The same thing can happen between the neck, shoulders, and headaches. The body is constantly redistributing tension and load based on what it believes is the best available strategy. This does not mean the pain is all in your head. The symptoms are real, but it does mean the nerve system, movement patterns, stress level, sleep quality, and physical loading all influence how pain is experienced. That's why effective treatment often requires looking at the entire system rather than chasing only the painful spot. During an in-home visit, I assess how different regions of the body are working together during movement. This includes joint motion, muscular coordination, breathing mechanics, posture, and compensation patterns. Treatment may include chiropractic adjustments, soft tissue and fascial work, dry needling, and movement-based strategies depending on what your body needs. The goal is to improve how the system functions overall so your body doesn't have to keep redistributing stress and tension from one area to another. Pain patterns are often more complex than simply one bad muscle or one misaligned joint. The body is adaptive, dynamic, and constantly responding to stress and movement demands. Understanding that changes the way we approach treatment. If your pain seems to move around your body and you felt frustrating trying to understand why, you're not alone. In many cases, there's a reason your body is adapting the way it is. If you're in Highlands Ranch, Sterling Ranch, Littleton, or the surrounding South Denver area, you can check out availability on this page. And if you have any questions before booking, feel free to reach out. I'm always happy to help.